Hi, everyone. Welcome to our lecture this week, which is about screening for psychosis. I hope that everyone's having a good week so far. So we're going to talk about the symptoms of psychosis. The main symptoms of psychosis include hallucinations. So remember that hallucinations are where a person hears, sees, and in some cases feels, smells, or tastes things that do not exist um, outside their mind, but can feel very real to the person that is affected by them. So an example of a hallucination would be hearing voices that someone standing next to you doesn't hear. Delusions, which occur where a person has strong beliefs that are not shared by others. So a common delusion would be someone believing that there's a conspiracy to harm them. The combination of hallucinations and delusional thinking can cause severe distress and a change in behavior. The symptoms of psychosis are often categorized as either positive or negative. Positive symptoms are those that add to or distort the person's normal functioning. They include delusions, hallucinations, disorganized speech, thoughts, or behavior. So some examples of that can include switching rapidly between subjects and speaking, finding it hard to concentrate or follow a conversation, being unable to complete everyday tasks. Negative symptoms involve normal functioning with it becoming lost or reduced. So some of those things can include restricted emotional and facial expressions, restricted speech and verbal fluency, difficulty with generating ideas or thoughts, reduced ability to begin tasks, reduced socialization and motivation. Some other symptoms overall can include cognitive symptoms like difficulties with attention, concentration, and memory, mood changes, suicidal thoughts or behaviors, a change or excessive substance use, and sleep disturbances. So talking a little bit about causes. Oh, I apologize for that. There is no one cause of psychosis. Psychosis appears to be the result from a complex combination of genetic risk, differences in brain development, and exposure to stress or trauma. Psychosis may be a symptom of a mental illness, like a serious mental illness such as schizophrenia, bipolar disorder, or severe depression. However, a person can experience psychosis and not be diagnosed with an SMI. For some older adults, psychosis symptomology can be part of a physical or mental illness that emerges later in life. Some of those diagnoses include Alzheimer's or Parkinson's or other types of dementia. Other possible causes of psychosis can include sleep deprivation, some types of prescription medication, and sometimes like a misuse of drug or alcohol use. And it's really important if you're diagnosing a serious mental illness to exclude all the things that I've just mentioned. So we want to talk about behavioral warning signs. So along with the symptoms just mentioned, a person with psychosis could also experience more general changes in their behavior. So those include emotional disruptions, anxiety, lack of motivation, difficulty with their overall functioning. In some cases, a person that experiences a psychotic episode could behave in a confusing and unpredictable way that's not similar to how they behaved before. This could include harming themselves or others, becoming violent. The risk of violence and suicidal thoughts or actions decreases with treatment for psychosis, but it's really important to pay attention to behavioral warning signs. So these are some quick screening questions. They may seem like questions that you would not think of asking in the case of psychosis, but again, if you're witnessing psychosis symptomology, we have to rule it out before coming to the understanding that someone is experiencing a serious mental illness. This was our very quick lecture for this module, and I hope you all have a really good day. Thanks.